Hello and welcome to Locimania, Endocarditis. Infection of the inner lining of your heart, which is the endocardium. The symptoms, fever, anemia, shortness of breath, murmurs are common, but the most characteristically you will see Janeway lesions, which are small erythemas on the palms of your hands. You will see splinter hemorrhages, which is nail bleedings, Osler's nodes, which also are lesions of your feet and palms, and lastly Roth spots, which are small lesions on the retina of the eye. I'll give you a mnemonic right away. I call it from Jane because of the Janeway lesions. From, so you write down from and Jane. F for fever, R for Roth spots, O for Osler's nodes, and M for murmurs. And then you have Jane, J for Janeway lesions, of course, A for anemia, which can occur in this kind of a patient, N for nail bleeding, and E for emboli, which is one of the complications. Causes of endocarditis is mainly bacteria. So just think about how bacteria can enter the body. So oral activities, which can be anything from brushing your teeth, eating something, drinking something, you name it. Skin lesions, STDs, inflammatory bowel diseases, needles that narcotic people have been using, anything like this. Which bacteria may you see in this kind of a patient? Most commonly you'll see Staphylococcus aureus, Streptococci viridans, and a group of bacteria called HACEK, which is a specific group of bacteria. Looking at the risk factors and complications of endocarditis, you can see that first off we have artificial heart valves is a risk factor because it affects the inner lining of the heart and most commonly valves. So artificial heart valves is a risk factor for endocarditis. Also prior endocarditis, and as we mentioned before, the needles. Complications, you can have stroke or organ damage, pus traveling through the bloodstream causing infections elsewhere, and lastly a complication is heart failure, which can occur when the endocarditis is not treated and just left alone. Lastly, you have diagnosis and treatment. You do a blood test and culture the blood in order to see if the patient has any anemia, which is a sign of endocarditis. You need to identify the bacteria in the bloodstream. You do a transesophageal echocardiogram in order to look at the valves of the heart because they may be damaged in endocarditis. ECG could be performed by the doctor if the doctor feels that the endocarditis is causing any kind of irregular heartbeat in the patient. Chest X-ray to check for any enlargement of the heart, and CT scan lastly to check if the infection has spread anywhere else in the body, so brain or chest, anywhere else. Treatment. IV antibiotics, often very high doses in order to beat the infections and the bacteria. Could be from 2 to 6 weeks. Surgery, you need to look at usually the valves need some kind of a help, a stent or repair. And also if it's a fungal infection, you need to do a surgery. And that's everything for endocarditis. Thank you very much for watching. I'll see you next time.